Do you think you might have knee arthritis? Has it been getting worse and worse as the days go by, weeks, months, possibly even years with this problem? Are you concerned that you might need a surgery someday? Maybe a doctor told you that you might need a knee replacement, or you had a parent or somebody else in the family with similar knees to yours and they had a surgery done, a knee replacement or some other procedure. I'm going to talk with you about the top 3 signs for knee arthritis, how to spot it, and what you should do if you find that you've got these signs. My name is Dr. David Midoff. I'm a manual therapist and I'm the owner of Paso Manual Physical Therapy. And I help people with knee arthritis all the time. So I see this and touch it and feel it every day. The technical term for knee arthritis is osteoarthritis of the knee. There's different types of arthritis. I'm just going to make it clear right now that I'm not talking about psoriatic arthritis or rheumatoid arthritis. Those are different conditions that affect joints. But osteoarthritis is the most commonly found type of arthritis in knees. So I'm going to talk with you about the top 3 signs of knee arthritis, osteoarthritis. Number 1, stiffness in the knee, especially when you wake up in the morning, you have trouble bending or straightening it out, or if you've been sitting for a long time, like if you've gone to the theater or you've sat at home and watched a movie, or you've taken a long trip in the car and when you go to get up in your first few steps, they're a little rough, your knee doesn't work just right, you need to take a few steps or a few minutes to make sure that it moves more normally again. That is a classic sign of knee arthritis. Number 2, swelling. If you find that your knee is swelling, there's usually some pain associated with it. Not always, but most of the time there's some pain with that. Right around the kneecap, sometimes on the back of the knee, people will get pain behind the knee in this swelling situation. There's something that might develop on the back of the knee called a Baker's cyst. That looks like some massive swelling behind the knee, and most of the time people have trouble bending the knee because the cyst is painful. That is usually related to knee arthritis as well. And the 3rd sign is a loss of motion. If you look at both knees, if one is more affected than the other, if you have trouble straightening one of your knees out or bending that same knee all the way, it doesn't move like your other knee, that's another very classic sign that you've got knee arthritis. Now, most people that learn this information start to think to myself, I'm screwed, my knee is done, I'm just gonna have to have the surgery, it's just a matter of how long can I hold out. And I want to tell you that we have cases here in the clinic all the time that regain their motion, stop swelling, and they feel great in the morning. Their knee feels like their other knee, and they literally feel younger and more mobile right when they wake up in the morning. There's tons of causes of knee arthritis. It's usually a combination of a joint problem, a cartilage problem, a muscle issue, ligaments, a nerve issue, problems coming from the back, problems coming from the foot as well. And here in the clinic, we look at all of that to properly make a plan to reduce and possibly even eliminate the stiffness and swelling and all the problems that are associated with knee arthritis. And it is possible, even if you've had an MRI or X-ray that shows arthritis in your knee, it is possible to feel normal again despite arthritic-like changes in your knee. And the reason for this is because if you restore everything else, the arthritis itself may not be the main problem causing your pain or your limitations. Now, if you're looking for help for your knee arthritis problem, I strongly suggest you talk to a manual physical therapist, a specialist in handling these types of knee arthritis problems without having to deal with surgery, injections, or pain medications. That, in my opinion, is the best way to make sure that you get long-lasting recovery and that you learn everything that you need to so that you can make the best decisions on your own each day moving forward in how to properly manage your knee. I hope that we can be a part of your success story in getting rid of this knee arthritis and getting your life back to normal so that you can be on your feet as long as you want, go through the store, go up and down stairs, kneel down onto the ground, and do whatever the heck you want with your knee without having to worry about having a surgery or getting injections or relying on painkillers for it. I wish you the best day. Bye-bye.